Hello and welcome to this informative video on the different types of asthma and their characteristics. Asthma is a chronic respiratory disease that affects millions of people worldwide. It is a condition that causes inflammation and narrowing of the airways, making it difficult to breathe. Understanding the different types of asthma and their triggers is essential in managing the condition and preventing severe asthma attacks. In this video, we will discuss the various types of asthma, including allergic, non-allergic, exercise-induced, and occupational asthma, and their specific characteristics. We will also cover common symptoms, diagnosis, and treatment options available for asthma management. By the end of this video, you will have a better understanding of asthma and how to manage it. So, let's dive in and learn more about the different types of asthma and their characteristics. 1. Asthma is a complex condition that can manifest in different ways, and the various types of asthma have distinct characteristics and triggers. Allergic asthma is the most common type of asthma and is triggered by exposure to allergens such as pollen, dust mites, and pet dander. Non-allergic asthma, on the other hand, is triggered by factors such as stress, cold air, smoke, and air pollution. Exercise-induced asthma occurs during or after physical activity, while occupational asthma is triggered by exposure to irritants in the workplace, such as chemicals or dust. Understanding the specific type of asthma a person has is essential in developing an effective management plan to prevent symptoms and manage the condition. 2. Allergic asthma is the most common type of asthma and is triggered by the immune system's response to allergens such as pollen, dust mites, and pet dander. When a person with allergic asthma is exposed to these allergens, their immune system overreacts and triggers inflammation in the airways, leading to asthma symptoms such as coughing, wheezing, and shortness of breath. Managing allergic asthma typically involves identifying and avoiding allergens, taking medications such as inhaled corticosteroids or bronchodilators to control symptoms, and working with a healthcare provider to develop an asthma action plan. 3. Non-allergic asthma is a type of asthma that is not triggered by allergens. Instead, it is triggered by various non-allergic factors such as stress, cold air, smoke, and air pollution. Non-allergic asthma can also be triggered by exercise, viral infections, or certain medications. Symptoms of non-allergic asthma are similar to those of allergic asthma and can include coughing, wheezing, chest tightness, and shortness of breath. Managing non-allergic asthma often involves identifying and avoiding triggers, taking prescribed medications to control symptoms, and following an asthma action plan developed with a healthcare provider. 4. Exercise-induced asthma is a type of asthma that is triggered by physical activity, such as running, cycling, or swimming. It usually occurs within a few minutes of starting exercise and can cause symptoms such as coughing, wheezing, chest tightness, and shortness of breath. Exercise-induced asthma occurs because physical activity increases the breathing rate, which leads to the airways drying out and becoming inflamed, resulting in the onset of asthma symptoms. Management of exercise-induced asthma typically involves using a short-acting bronchodilator inhaler before exercise to prevent symptoms, warming up before exercise, and gradually increasing the intensity of exercise over time. It's important for individuals with exercise-induced asthma to work with their healthcare provider to develop an appropriate management plan. 5. Occupational asthma is a type of asthma that is caused by exposure to irritants or substances in the workplace, such as chemicals, dust, or fumes. This type of asthma can develop after years of exposure to workplace irritants or after a single exposure in some cases. Occupational asthma can cause symptoms such as coughing, wheezing, chest tightness, and shortness of breath, which can affect an individual's ability to work. Management of occupational asthma typically involves identifying and avoiding exposure to the irritants that trigger symptoms, using protective equipment, and taking medication to control symptoms. It's important for individuals with occupational asthma to report their symptoms to their employer and work with their healthcare provider to develop an appropriate management plan. 6. Asthma is a chronic respiratory condition that can cause a range of symptoms, including wheezing, coughing, shortness of breath, and chest tightness. These symptoms occur when the airways in the lungs become inflamed and narrowed, making it difficult to breathe. The severity of asthma symptoms can vary from person to person and can range from mild, occasional symptoms to severe and persistent symptoms that can significantly impact an individual's quality of life. Managing asthma symptoms typically involves developing an asthma action plan with a healthcare provider, avoiding triggers that can worsen symptoms, taking medications to control inflammation and open the airways, and monitoring symptoms to adjust treatment as needed. 7. The severity of asthma can range from mild to severe, and can even be life-threatening in some cases. Asthma can range in severity from mild to severe, and in some cases, it can even be life-threatening. Severe asthma symptoms can include extreme difficulty breathing, wheezing that does not improve with medication, blue lips or face, and a rapid pulse. These symptoms require immediate medical attention, as they can indicate a severe asthma attack that can be life-threatening. It's important to note that asthma severity can vary from person to person and can even change over time, so it's essential to work with a healthcare provider to develop an asthma action plan tailored to an individual's specific needs. With proper management, most people with asthma can live normal, active lives and avoid severe symptoms and complications. 8. Asthma can be diagnosed through a combination of medical history, physical examination, and lung function tests. Medical history. A healthcare provider will ask about an individual's symptoms, including when they occur, how often they occur, and whether they are triggered by certain factors such as exercise or exposure to allergens. The healthcare provider may also ask about family history of asthma or allergies. Physical examination. A healthcare provider will perform a physical examination, which may include listening to the lungs with a stethoscope to check for wheezing, and examining the nose and throat for signs of allergic rhinitis. Lung function tests. Lung function tests are used to measure how well the lungs are working. The most common lung function test for asthma is called spirometry, which involves breathing into a device called a spirometer that measures the amount of air a person can exhale and how quickly. Another test called a bronchoprovocation test may be performed to help diagnose asthma. In this test, a person inhales a small amount of an irritant to see if it causes the airways to narrow and trigger asthma symptoms. Based on the results of these tests, a healthcare provider can make a diagnosis of asthma and develop an appropriate management plan. 9. Treatment for asthma typically involves the use of medications to manage symptoms and prevent flare-ups. Bronchodilators. Bronchodilators are medications that work by relaxing the muscles around the airways, making it easier to breathe. They are often used as a quick relief medication to treat symptoms such as wheezing and shortness of breath. Short-acting bronchodilators are used on an as-needed basis to relieve acute symptoms, while long-acting bronchodilators are used regularly to prevent symptoms from occurring. Inhaled corticosteroids. Inhaled corticosteroids are medications that are used to reduce inflammation in the airways. They are typically used as a long-term controller medication to prevent asthma flare-ups from occurring. Inhaled corticosteroids are considered the most effective medication for preventing asthma symptoms and are recommended as a first-line treatment for most people with asthma. Other medications. Other medications used to treat asthma include leukotriene modifiers, which help reduce inflammation and improve breathing, and immunomodulators, which help regulate the immune system to reduce inflammation in the airways. In addition to medications, it's important to avoid triggers that can worsen asthma symptoms, such as allergens, air pollution, and cigarette smoke. Regular exercise, a healthy diet, and stress management can also help manage asthma symptoms and improve overall health. Working with a healthcare provider to develop an individualized asthma action plan is essential to effectively manage the condition and prevent complications. 10. It's important for individuals with asthma to work closely with their healthcare providers to develop an asthma management plan that addresses their specific needs and triggers. An asthma management plan is a personalized plan that outlines how to prevent and manage asthma symptoms, including what medications to take, how to monitor symptoms, and what to do in case of an asthma flare-up. The plan may also include steps to avoid triggers that can worsen asthma symptoms, such as allergens, pollution, and tobacco smoke. Working with a healthcare provider to develop an asthma management plan can help individuals better understand their condition, improve their ability to manage symptoms, and reduce the risk of asthma flare-ups and complications. It's also important to regularly review and update the asthma management plan with the healthcare provider to ensure that it remains effective and meets changing needs over time. In addition to developing an asthma management plan, individuals with asthma can take steps to maintain overall health, such as regular exercise, eating a healthy diet, and managing stress. These lifestyle factors can help improve asthma symptoms and reduce the risk of complications. That's all for today's video on the different types of asthma and their characteristics. We hope this video has provided you with valuable insights into asthma, its triggers, and management. Remember that asthma is a chronic condition that requires ongoing monitoring and treatment, and it's important to work with your healthcare provider to develop an asthma management plan that meets your specific needs. With the right care and management, individuals with asthma can lead healthy, active lives. If you found this video helpful, don't forget to like and subscribe to our channel for more informative content. Thank you for watching, and we'll see you in the next one.